I am at the annual meeting of the Menopause Society, and I'm speaking with
Dr. JoAnn Pinckerton.
And Dr. Pinckerton, tell us just as thumbnail of all of your many titles.
So I'm professor of obstetrics and gynecology at the University of Virginia. I direct a large midlife health center, and I am the executive director emeritus for the Menopause Society.
And one of the top menopause specialists in the country, if not the world.
Thank you.
I know that you have recently, most recently, been working on a new medication in terms of a study called Elinzanetant. What is Elinzanetant?
Elinzanetant is a dual neurokinin receptor antagonist. It works on neurokinin 1 and 3. Elinzanetant, which is FDA approved as of May 2023, is a neurokinin 3 receptor antagonist. So Elinzanetant is different because it works on 2 receptors, one we think for hot flushes, and then one which it appears to potentially improve mood and sleep.
So this is a new oral medication for hot flashes that's not estrogen.
That's correct. It's a non-hormone. It's an investigational compound. The data has just been submitted to the FDA.
And tell me what your study found.
So we have just recently published the results of the first 2 pilot phase 3 clinical trials, OASIS 1 and 2, which were 26-week trials with a crossover at 12 weeks, so that we found a reduction in the frequency and the severity of hot flushes as quickly as within a week. But we also saw an improvement in mood and sleep, which was maintained to 26 weeks. At the Menopause Society, we are presenting data from OASIS 3, which is a 52-week clinical trial looking at safety and efficacy of Elinzanetant over a year-long period.
So you started with a 6-month study and now have a year study.
Correct.
And you're finding this medication, a non-estrogen, is very effective for hot flashes, for sleep, and for improving mood.
Correct. So the reduction in frequency and severity of hot flushes were primary objectives. The reduction within a week was a secondary, as was mood and sleep. And then at a later date, we have a trial called Nirvana, which is going to be looking at its effect on sleep in people with sleep disruption. Versus in these 2 trials, it was women with bothersome hot flashes. The first 2 trials, the shorter trials, 26-week trials, took very symptomatic women with 50 hot flushes a week that were moderate with sweating or severe disruptive. The OASIS 3 took women who had bothersome symptoms, but they did not have a preset number, more like what you would see in clinical practice. So the good news is that our shorter trial confirmed in those highly symptomatic women how effective it was compared to placebo, and our longer trial was a little bit more like clinical practice, when women might have 5 or 6 hot flushes, they might be of differing severity, and it still was effective at 12 weeks and sustained efficacy to 52 weeks.
So did these ladies have any difficulties taking the medication? Were there any problems with it, or how did they do with it?
So overall, they did very well. In the short trial, the main side effects were headache and fatigue, and in OASIS 1, arthralgias. In the longer 52-week OASIS 3 trial, we kept those same, added somnolence and also COVID-19, which was actually higher in the placebo group, but still was seen in the trial.
Interestingly, so you're not selling this as, you're not selling it at all, but it's not being considered as a treatment or prevention for COVID, but it did, anecdotally, it seemed to have, certainly didn't make it worse.
It didn't make COVID-19 worse. Beyond that, there's nothing you can say from a clinical trial done during the pandemic.
Anything I'm leaving out here that should be pointed out?
You know, up until this point, for women who either can't take estrogen or choose not to take it, we haven't had very effective therapies. We've had the low-dose paroxetine salt, which was the first FDA-approved therapy, and then last year, Elinzanetant was approved. It goes by Viaze, which is really good with reduction of hot flushes, and had some improvement in sleep and mood, probably related to the hot flashes. Also has a liver warning that you have to check the liver function test.
That's the Elinzanetant.
That's the Elinzanetant. And what we hope with Elinzanetant is that because it's a neurokinin dual receptor antagonist, we're going to get better effect on the hot flushes as well as better effect on mood and sleep. And at least in the clinical trials, it was very favorable for safety. There was no endometrial hyperplasia or cancer, and there was no liver toxicity that was observed in either the shorter trials or the longer trials.
Do you think that this medication, assuming no one ever knows until it happens, but do you think this is something that will be available to consumers in 2024, or do you think it may reach into 2025? Or
I would expect, just based on watching the FDA in general, that it'll be 2025 before it becomes available.
Well, thank you very much.
It's exciting for women to have a new option that really treats the triad of hot flushes, sleep, and mood. I was excited to do the trial. I'm even more excited by the findings. I will add one more comment. There is another trial that is finishing up, and it's actually going to go into another year extension called OASIS 4, and that is women who are either at high risk of breast cancer or who have had breast cancer. They can be on tamoxifen or an aromatase inhibitor, and so the first year went well. They've got an extension going, so we're going to be really treating it in that population that needs it the most, women who are either at high risk of breast cancer or who've had breast cancer.
So the women who are on tamoxifen or other aromatase inhibitors are able to take
Yes,
this medication?
there's no concern about its mechanism. The structure is totally different from Elinzanetant. There's no concern about taking it. Now we just want to show efficacy and safety in the population of women that we think are really at the highest risk of not being able to use estrogen.
Very cool. Thank you very much.
You're welcome.